Dr. Stephen Chenault, your Ashtabula area chiropractor here, and I'm here to talk about more common things that you may have been told is your issue or that you know is your issue, right? So the phrases that we tend to hear about these things that cause low back pain and sometimes leg pain as well, so sciatica, are what we call a disc herniation or a slip disc or a disc bulge. Now, the first thing we need to do is understand what that means. And all that means is that in my little drawing of a spine here, where you have your vertebrae, which are the bones of your spine, you have your spinal cord behind, and that's the back of the bone here. And what you have between each of these vertebrae is the little thing that we call a disc. And they work almost like a little cushioning factor for your spine. And it allows us to bend and move and do all the things we need to do throughout the day without putting too much load on the bones. Now, what happens with age, with repetitive movements, and sometimes with a very brisk movement, is you can cause a bit of damage to the disc. Usually when that happens, you get pain that is very, very localized to the back, and it hurts pretty badly for a few days, then it gets better and better and better, usually by itself. Now, what can happen if it doesn't happen quickly like that is sometimes we get more of a chronic injury that comes and goes and comes and goes. And with that, that's when people start to use the terms like, I slipped my disc, or, my disc is bothering me again. And in a lot of those patients, they'll end up getting an MRI because their doctor will send them out thinking, okay, well, let's make sure it's nothing serious. And you might see one of these little discs pushed a bit back into the spinal cord. Most of the time, that's not really an issue. It's something that resolves on its own, and it's a normal part of aging in most of us. But in some people, it does cause some irritation to the spinal cord or to the nerves just next to it. And with that, you tend to get either a bit more back pain or even back pain that can go into the butt and down the leg. The nice thing with those is most of the time, if it's worse in certain positions and better in other positions, we can usually help you without surgery, without any special injections or drugs. And usually we just need to do some treatments like chiropractic manipulations, maybe some different type of acupuncture and needling techniques can be helpful. And definitely the number one thing is getting some specific exercises to correct that problem. So if you know someone who suffers with these, or if you suffer with them, talk to your doctor or give us a call, like us, subscribe, and we'll talk to you next time. Bye-bye.